¿Qué tal, amables y gentiles televidentes? De nueva cuenta les saludo a su amigo y servidor Armando Rangel, el locutor número 19 en uno más de los programas de In the Blink of an Eye, cortesía de Pueblo Tires and Service, aquí en 5.2 Somos el Valle, como pasa todos los sábados a las 6:30 de la tarde. Y pues estamos aquí en un programa más, en una ubicación que vamos a mencionarles en unos momentos, pero para eso tenemos aquí a nuestro compañero, a nuestro capitán, Benjamín Valdés. Muy buena tarde, Ben.
Así es, Armando, gracias. Pues amigos, así estamos aquí en Nova Medical Center, como dijo Armando, donde practican medicina ocupacional.
Claro que sí, 100%. Sí, señor.
Vamos a entrevistar a un médico aquí, vamos a hablar con también otro caballero encargado de aquí este lugar, pero vamos a hablar sobre lastimaduras, we're going to talk about injuries, maybe how to prevent injuries, cómo prevenir, terapia y muchos de los servicios que ofrecen aquí.
Claro.
Y Armando, a nadie le gusta hablar de lastimadura, ¿verdad? Pero
no.
son parte de la vida a veces.
Son muy dolorosas, ¿eh?
Yeah. Son muy dolorosas.
Muy dolorosas.
You know, injuries are part of life sometimes. En el trabajo nos lastimamos, se lastiman. Y el caso es que aquí en este lugar ofrecen ayuda y ayudan a las personas que tienen lesiones o lastimaduras para que puedan recuperarse.
Claro que sí.
Y Armando, pues en una forma personal, tú sabes lo importante que es la terapia, ¿verdad?
Como dicen por ahí, tell me about it.
Yeah.
Sí.
Y su servidor también, en one occasion or two, he tenido que tener physical therapy también. Me quebré un dedo en una ocasión y me rompí un tendón de este brazo.
Y si vamos a empezar a presumir de lastimaduras, yo me rompí la patela en dos.
No, pero sabes que mira, aquí
ya vamos a empezar a presumir.
Me rompió el corazón. Me rompió el corazón, así es que ya con eso te haré.
Seguro.
Pero amigos, una vez más bienvenidos al programa en un abrir y cerrar de ojo en The Blink of an Eye. We welcome you, we thank you. Y Pueblo Tires es patrocinador de este programa.
Claro que sí.
Ya llevamos para 2 años, ¿verdad, Armando?
Sí, señor.
2 años.
Muy contentos de estar a través de 5.2 Somos el Valle en este programa semanal que, como le decíamos, pasa todos los sábados a las 6:30 de la tarde, 5.2 por antena o 12:40 en cable.
Y no olviden, amigos, que Pueblo Tires Servicio ahora tenemos 13 locales para servir.
Sí, señor.
13 locales, les invitamos que nos busquen la red en shampoozy.com o llame al 855-412-8473. Así que con esto en mente vamos ahorita a tomar una pausa y vamos a regresar y vamos a estar entrevistando a un médico de aquí, de este lugar. Así es que les agradecemos la oportunidad de brindarles estos programas, Armando. Para nosotros es un placer.
Claro que sí.
De traer esta información a la comunidad, ¿verdad?
Seguro.
Porque ya sabes, como lo hemos hecho y lo vamos a continuar haciendo, primeramente Dios, vamos a ofrecer mucha información de diferentes organizaciones de aquí del Valle que son de gran beneficio para la comunidad. Así es que una vez más, de parte del capitán y el locutor
número 19.
Vamos a regresar, vamos a tomar una pausa y regresamos en The Blink of an Eye.
Winter, spring, summer, and fall, the cycle continues for us all. 2018 is come and gone. Change your oil, you can't go wrong. That's right, you betcha.
So now you're a poet too, Shampoozy?
12 months ain't enough. Up 24 months to pay, and you'll be on your way. Ain't no credit needed. That's right, 2019, you will sing Shampoozy.com. So much fun. Que bailen!
Think tires, think Pueblo.
Así es, amigos, hasta 24 meses para pagar y no necesitas crédito. Si ellos dicen no, nosotros decimos sí. Llevo eso al banco, puedes apostar.
No hay tal cosa, Shampoozy, te apuesto.
Sí, tienes la opción de hasta 100 días para pagar temprano. No esperas el income tax, ven hoy mismo. Aplica, compra y disfruta. Así es, shampoozy.com. ¡Que bailen!
Muy bien, televidentes, continuamos en su programa In the Blink of an Eye a través de 5.2 Somos el Valle, 12:40 en cable, y estamos aquí en Nova Medical Center, 403 Norte Jackson, en la ciudad de Far, en una entrevista muy interesante con el capitán Benjamín Valdés. Benjamín, adelante.
Yes, welcome back to In the Blink of an Eye. Thank you, Armando. And yes, we're here at Nova Medical Center, and now we're going to speak. We're going to change the gear, the tone of the voice. Vamos a hablar un poquito Spanglish, a little bit of English. We're with Dr. Ruiz. Doctor, thank you for having us.
Thank you for having me here. Yes,
well, Dr. Ruiz, and if I may ask you, what's your name, your full name?
My name is Dr. Peter Anthony Ruiz.
Peter Anthony Ruiz. Wow,
Yes.
that's pretty cool.
Yeah.
Peter Anthony. I'm just Benjamin.
Como nombre de telenovela, ¿verdad?
Sí, Peter Anthony. Wow, that is it's like a movie star name there. Well, Dr. Ruiz, thank you again, Nova Medical. You know, folks, at Nova Medical, and I'll say this on behalf of Pueblo Tires, We use Nova Medical quite extensively when we're looking for new hires. And we send them here for some screening and so forth. But they do a lot of occupational medicine here. So Dr. Ruiz, tell us a little bit about yourself, sir. How long have you been with this company or this organization?
It's been a little over 5 years now. I actually was one of the first physicians here. I did have someone fill in for about a month when they first established the clinic, but I've been here for the most part since the beginning.
Okay.
So
So how many physicians are there in this location?
I'm the only physician.
Oh, the only physician.
Sole practitioner,
Okay.
yes.
So you got your hands full.
Oh, some days I do. That's very true, very true.
Wow. Okay. Now, if I may ask you this, what got you started in the medical field? I mean, is that something that is in family, or you just decided I'm going to go into the medical field?
Yeah, I always had interest when I was a child, when I was younger. I never pursued it for a time, and then as I got older, I decided to pursue it. And so as I worked hard, set my goals, met the goals, and here I am today. So very fortunate.
Now, as a physician here at this location, what is there a specialty you have, or what is it that you? Because I know out there, I know there's specialists in heart doctors or lungs or
Exactly.
general doctors. What is it that you practice?
Exactly. I'm actually trained in family medicine, so I
Okay.
could do all kinds of different medicines. Although here at this particular facility, we just do occupational medicine. Occupational medicine has to do with workers and work injury.
Okay. And speaking of that, I've had a couple of injuries myself in my lifetime. And I can tell you, Armando, I think you know they're not fun, and
No.
they're painful.
Muy dolorosas.
And I've had I've seen injuries through my lifetime at work or at home that people were never the same. Sometimes
Very true.
it happens and it's unfortunate. And but again, it's part of life. But there are things we can do to prevent. I believe there's some things. You got to be
Very
extra
true.
careful at work. We're in an industry where we're dealing with tires and wheels and machines. You talk about tire machines, alignment machines, grinders. So there's a lot of moving parts. And, we tell our guys you got to be extremely careful. For example, if you're working with a machine that's a grinder, it's important to wear your safety glasses.
Very true.
Do you see those type of injuries here, like eye injuries?
I do see eye injuries very commonly. You want to make sure you have proper eye care, eyewear. Sometimes people are wearing lenses, but there's openings to the side, and especially if you're grinding, things of that nature, you could still get some particle in your eye if it's not fully protected. So I do see that from time to time, even with people who do have some protective eyewear, they just don't have appropriate protective eyewear.
So you treat people with eye injuries here as well?
I do, yes, I do.
Wow. Many moons ago, I had an eye injury, and I was wearing a shield, a protective shield, and I was grinding in a machine shop way back when in Houston. And that protective shield, it's there to cover, but there is openings up on the top.
Exactly.
And somehow or other, some little tiny fragment of a piece that I was grinding, it was made out of it wasn't steel, it was like lead or some sort, but it got into my eye turned red that evening, it just felt terrible. And the next morning my eye looked like a tomato.
Sure.
And I was sent to the doctor, and I remember they put me in a room something like this, and they put my eye in a vise, my head in a vise, and he turned off the lights, he put on some kind of blue light or something, and he said, okay, let me see. Oh yeah, I see it. I said, really? And I tried to see in the mirror, I couldn't see nothing. My eye was just red. But he said, okay, you got something there. So what is it? It's a little piece of steel. Okay, so now what? Let me take it out. I said, okay, how are you gonna do that? I had never experienced anything like that.
Sure.
So my head's in a vise. He says, and he got looked like a needle. He said, don't blink, okay? So I'm like this, my head's in the vise. He said, and he put the needle I was looking. First he put some drops, and then he said he just put that little piece of needle, looked like a needle, right there. As soon as he touched it, instant relief. And I said, wow, just like that. That needle, does it have a magnet in it? Or
It
what?
does. Those are magnetized, yes.
Wow. Well, I felt instant relief like that. And of course, I had to wear a patch, for a couple of days. But eye injuries can be serious, and I was
Definitely
fortunate, that I didn't hurt myself anymore, even in spite of wearing the shield.
Sure.
So you can do everything you need to do, first of all, and sometimes things will happen that, you just cannot, because we're humans.
Exactly.
And so, doctor, is there any particular injury that you see maybe frequently here, or that you could say there's more of these injuries that occur?
Sure. The most frequent injury is probably the back injury.
Back injury.
Yeah, there's different ways that people hurt their backs. Many times it's not lifting properly or lifting something that's too heavy. So especially when there's a heavy object, it's always important that you get a partner to come help you. So, or sometimes different companies have equipment that helps you lift. And I see that maybe the employee is in a rush or in a hurry and won't go get the equipment and attempts to lift it themselves, even though they know it's heavier than what they should be lifting. So another way people hurt their backs is oftentimes they slip. So whenever there's a wet floor, make sure it gets mopped up and make sure there's some sort of notice or sign that shows people that it's still a little wet and needs time to dry. Sometimes oil or grease might spill and people may not see it. And as they're walking by, they may slip on it. So if you happen to spill it, you should wipe it right away, notify people around you just so they don't slip and fall by accident. But those are probably the most common means of hurting your back, and the back is very, very commonly injured.
Well, my associate here, Armando, you had a slip and fall.
Sí, me quebré la patela en dos.
Sí, sí.
Dolorosísimo. Duele
Sí,
bastante.
sí.
No sé, como dicen que duele más que un parto, no sé, no, pero yo me recuerdo que duele tanto. A tal grado que antes, doctor, yo tenía pánico a las agujas cuando me sacaban sangre.
Sí.
Ahora cuando voy digo, haz lo que quieras. Este dolor de la aguja no es nada comparado con el dolor de un hueso roto.
Sí,
y después también se me quebró parte de la tibia.
Sí, sí, sí.
Se me astilló, también dolorosísimo, muy
Pero
doloroso.
usted está como Evel Knievel.
Traigo los accidentes. Tengo magneto para eso, ¿eh?
Doctor, as far in injuries, and we were sharing, stories about. I broke this finger in Houston. We were playing basketball, and these guys were playing softball, and somebody hit the ball far enough. It came over into where we were playing basketball, and I jumped up to grab the basketball, and the softball came from out of the sky and hit me right there. It just kind of nipped it, boom, and my finger turned like a grape. I mean, it just swelled up. And well, okay, let's go to the hospital. It's probably broken. They took an X-ray. It was fractured right here in the tip.
Sure.
They put a shot in there, and so then I was sent to therapy a few days later. And I was telling my friends here that I went to a big room where they had all kinds of whirlpools and other objects, and people were in there, I guess, receiving physical therapy. I saw some people in a like a whirlpool up to their neck, some people up to their waist, and they said this whirlpool, that's for you. I said, what do you want me to do? Stick your finger in there like that? So I put my finger in like that. I said, you know what? This is embarrassing. I said, let's go. I'll just do it at home and put it in a glass of water. Because those people were up to their neck or up to their. They had probably a lot more serious injuries in mine than a finger, but
Sure.
That was something that I experienced, and I ruptured a tendon here, and I got some therapy, and then they take your arm, they kind of like this. Does this hurt? Yes. Does this hurt? Yeah. So, not only is the injury hurtful, but sometimes even the therapy
Recovery can be painful.
Exactly. So that is also part of the recuperation or the healing process.
Very true.
So,
Very true.
So backs is the kind of like the number one thing you see.
Yes. Very true.
So amigos and friends, and you hear this. I've seen reports. I've even seen a lot of people hurt themselves at home. A lot of injuries can happen at home.
Very true.
And you climb a ladder. You're gonna change a light bulb. Things that you don't take too much thought about doing, and before you could fall off a ladder, you can hurt yourself at home. A lot of injuries happen at home. So, doctor, is there any advice that you could give? Maybe I know that they come to you once they're injured, but what could you share with us for? I know, like we talked about, there's a lot of things we should do, but we should be extra careful and not take things for granted or be a little careless out there.
Very, very true. Very true. Sometimes when you're in a rush, you're not making the best decisions. So you should always make sure that you think about things before you do it. And especially if you're aware, like I said, as I mentioned before, when something's really heavy, it's heavy, make sure you go and get a partner to lift it or get the proper equipment that's supposed to be used to lift it so that you don't injure yourself. Also, Be aware of your surroundings. Sometimes there's people working near you or by you, and you need to pay attention to what they're doing as well. If you're not aware of your surroundings, you may run into someone or bump into someone who might be holding something that's scalding hot, or something that's sharp, or you may trip over someone who's in your surroundings. So you want to have an awareness of what's going on around you at all times, and not be in a rush, because when you're in a rush and you're not thinking, you're not going to be paying attention to things around you.
I was in El Paso recently visiting some friends of ours in our industry, tire company, and I was speaking to one of the gentlemen there that he's been there for many years, and he was telling me he was having some back problems. I said, what happened? He said he fell off a ladder years ago. He said he broke his back. I said, wow, that sounds painful. So he said they had to install a couple of rods down his side of the spinal cord.
Yes.
And he said, I've been doing well, but every now and then I get, it acts up or flares up. So I was just up there about 3 weeks ago, and he said he had to go get some more tests done because he was feeling a lot of pain. So, I mean, that sounds kind of serious to me. You have to put rods down your side of your spine. I mean, again, that's something that he walks and he moves. But, I guess there's been a lot of advances when it comes to back injuries, would you say?
Yes.
In the last few years, where sometimes people have hurt their backs and they're disabled or they just can't function anymore. So technology has made a great advancements when it comes to back injuries?
And yes, it has, and most people recover fully from their back injuries. Most people don't have injuries to that degree where they do need metal hardware or surgery, things of that nature. Even when they need surgery too, they even have microscopic surgery where they're really small incisions, and you actually recover really much quicker than in the past. So there has been a lot of changes in technology and advancements that have helped with back injury recovery and surgeries.
Have you ever had any back injuries, Evan?
Gracias a Dios, no. No. Con la patea la tuve. Con eso ya no quiero más.
I don't know if you call it a back injury, but there was one time that I was lifting some heavy objects throughout the day. And the next morning, doctor, I felt so stiff. I mean, I had never felt my back. It was just so stiff, and I could barely move. I said, wow, what's going on, And I got up and I took a shower, but throughout the day, I felt so stiff back in my back.
Yes.
So I said, well, maybe it'll go away. I was just trying to move as much as I could. And I think it took me 2 days, but on the second day, I remember getting out of the car, doctor, and I was still feeling rather stiff in my back. I heard like a pop. And when I heard that pop, felt good. I mean, what could have possibly happened? Was I out of line or what?
Yeah, a lot of times you can have an alignment issue. What likely may have happened initially as you were doing a lot of physical work and stuff, you may not have been accustomed to that.
Right.
And so it caused your back to go into spasm because it's very fatigued, overworked. Sometimes when the muscle is really tense or tight, it can adjust the alignment of your spine and pull it over a little bit. And that can cause pain or discomfort. And with pain or discomfort, the muscle tends to ball up again and tighten. And then it causes a little bit of misalignment. Once you realign it, it adjusts everything back to normal. The muscle can relax again, and sometimes it relieves your pain.
Wow.
That's why sometimes people go to chiropractors. Even here at our physical therapy center, they'll evaluate patients, and sometimes they'll do adjustments. And I've had it to where we've had one treatment of therapy, and the person was better.
Wow.
So it can happen.
Yo recuerdo que yo fui con un quiropráctico y sí es cierto, me dijo, no te muevas, y entonces me acomodó la cadera con el cuerpo y se oyó el tronido, pero bien fuerte, y se siente muy bien, ya cuando está acomodado. Es increíble, ¿eh?
It's amazing.
I know there's folks out there that offer massages, and they're not necessarily called chiropractors. They're massage therapists.
Sobadores o
Yeah.
¿cómo le llaman?
Yeah.
Yeah, and my father-in-law.
Hueseros les llaman.
My father-in-law, God rest his soul, he has suffered from back, stiffness throughout most of his life, and he worked in a place where he had to lift a lot of heavy stuff. But he went to this massage person here, and he says, a funny story. He says, no, but he was massaging my back. He told me to lay down. He grabbed me from the ankles, and he did like this. Like if you have a una sábana,
Shake the sheet.
Yeah. He said, whoa. He said, actually felt good for a little bit, for a couple of days, but came back.
Yeah.
But, doctors looking at Nova Medical Center, you all have a lot of locations, especially in the state of Texas.
Yes, yes.
And I noticed you all have one in Indianapolis, which is dear to my heart because my in-laws and my family, a lot of my wife's family's from Indiana.
Yes.
And you have one location in Indianapolis, but you said they're going to start another location up there?
They will be soon, yes.
Okay, and here in the valley, you've got three. Brownsville
Yes.
looks like Harlingen and
Yes.
McAllen.
Exactly.
And again, they do an excellent job when it comes to screening. And now, we don't look forward to sending people to you that are injured, but it does happen.
Not too many people do.
Yeah, it has happened. Again, es parte de la vida. Muchas veces los accidentes ocurren, pero
In the
aquí,
blink of an eye.
in the blink of an eye, that's right.
Yeah.
But doctor, we really appreciate what you do.
Yes.
And we thank you for making time to talk to us. And one day, maybe we'll invite you if you can come visit us at Puebla and give us a little health talk or,
Sure.
preventative accident measures, like you were talking about, backs. We have over 100 employees. And, we have a warehouse, we have the guys working up front. And like you said, sometimes they're in a hurry or take shortcuts. And we've seen multiple different types of accidents. But we would appreciate someday maybe you could join us out there. And what else could you share as far as, I know you've been here about 5 years and you've got 3 locations here in the valley. Throughout the state of Texas, it seems like you've got the most locations. And Tennessee, and looks like the state of Georgia.
Correct.
Correct? Okay,
Yes.
now you've never worked in any other location other than here?
I've actually worked at the El Paso location.
Oh, El Paso.
Yes.
Speaking of El
And,
Paso, I was just up there.
Yeah.
That's where my friend that fell down and broke his back.
Oh, really? Really?
And actually, he's in a tire company up there as well. And he broke his back some years ago, but to this day, it still bothers him from time to time.
yeah, I can imagine.
But Dr. Armando, you shared your war stories.
Sí.
But like I tell you, she broke my heart, so that beats yours.
Fíjate que años atrás presumíamos de otras cosas, de que mi carro, de que compré una guitarra nueva, y ahora estamos presumiendo de quebraduras,
De quebraduras.
de lastimaduras. Eso es lo que platicamos ahora.
So now, as far as therapy, doctor, do you have people that are just dedicated to that here, that are specialists, certified, or how do you classify
Yes,
those?
we actually have 3 staff therapists, and we have visiting therapists as well.
Okay.
We have a doctor of therapy, Dr. Havayana. He's here at this location, and then 2 physical therapy assistants that assist him with care. We always do one-on-one treatment to individualized treatment because each person has a different injury and has a different way of recovering. And so we like to individualize it because one treatment may work well for one patient but not another. So we want to make sure we give you the best treatment so that you could recover at your pace or recover as quickly as possible. And on occasion, we do have other doctors of therapy. Today, we have Dr. De Leon here with us, helping out Dr. Havayana, because we want to maintain that quality. So if we have 4 patients scheduled, we'll have 4 therapists. If we have 6 patients scheduled, we'll have 6 therapists. So we want that one-on-one individual quality care here. And so that's our goal, is to provide a good service and quality of care.
So let me see if I got this right. So let's say we have similar injuries,
Yes.
but the recovery or the therapeutic process to treatment could be different, even though it's the same injury?
It may be, yes.
Could be.
Depending on what works best for you and what works best for him.
Wow. So not necessarily what works best for him would work best for me.
Exactly.
Even though, let's say we have the same identical injury.
Exactly, but you both are different in a lot of ways.
Okay.
So you're not identical.
So
not identical.
when you say about different, I got a little more hair than he does. For example. No, but what I'm saying, like for example, your body weight,
And how you respond to certain treatments.
Okay.
And even though you may have a back injury, he may have more spasms in his back, and you may have an alignment issue.
Wow.
So with him, they may do more manual therapy where they're working out the muscle spasms, things like that, similar to what a massage therapist might do. For you, they may do something more like what a chiropractor would do and do an adjustment.
Wow.
So
Wow, well, thank you for sharing with us, Dr. Ruiz. And again, thank you for what you do. And thank you for Nova Medical being here. And, they're part of the community, and we need them just like any other organization. So that's what this show's about, is bringing you this information and reaching out to the community so that you can know of all the, some of the help and needs that we have with places like Nova Medical. There is a process here, just like any other organization. And part of that process, we'll be continuing our talks with, we're going to be talking to Diego Loera, who he's what's his position here?
industrial director.
Industrial director. He's going to talk to us a little bit more about the process what happens or what needs to happen for somebody to come and receive treatment here? Because I know you guys do a lot of work with workman's comp as well, correct?
Yes, we do primarily workman's comp.
Workman's comp, and
Yeah.
that's not
Work
something
injury.
we don't like to say that at work, but it's part of protecting our employees. We have to have that. So thank you, Dr. Ruiz.
Thank you.
Thank
It's a
you for
pleasure.
having us, and thank you for talking.
Mucho gusto, doctor.
Amigos, we're going to take a little break, and we'll be back in the blink of an eye.
Invierno, primavera, verano y otoño. El año 18 se ha terminado. Cambia el aceite de tu carro. Si no te dejará tirado. You betcha.
¡Ja! ¿Ahora te crees poeta, Shampoozy?
Tienes la opción de hasta 24 meses para pagar y no necesitas crédito. Cantarás un nuevo canción, shampoozy.com. ¡Qué alegría en mi corazón! Así es que bailen.
Think tires, think Pueblo.
Well, hey, folks, don't wait on your next paycheck or your income tax refund. That's just silly. We got payment options that include up to 100 days early payoff. You betcha, that's right.
So what happened to the 24 months to pay, Shampoozy?
Folks, we still got that. You can choose to pay early or take up 24 months. It's your choice, but do it today. Shampoozy.com. That's right, que bailen.
Think tires, think Pueblo.
Gentiles televidentes, llegamos ya al final de uno más de los programas. No nos quisiéramos ir, pero se nos termina el tiempo de uno más de los programas In the Blink of an Eye. Benjamín.
Así es, y fue un placer estar aquí con el doctor Ruiz de Nova Medical. Agradecemos al doctor Ruiz por la información que compartió con nosotros. Amigos, hay que tener mucha precaución, ¿verdad? En casa, en el trabajo, porque accidentes es algo que todos queremos evitar. Y cuando hablamos de lastimaduras y esas cosas, pues aquí en Nova Medical les pueden ayudar, pero nosotros los usamos aquí para ciertas cosas también de lastimaduras. Lamentablemente ocurren cosas. And again, we thank you, doctor, for being with us. Any final words, doctor?
Yeah, remember, what I always say is work smarter, not harder, and be safe.
There you go. And one thing, Pueblo Tires invites you to visit it today. We have 13 locations to serve you. We've been in business since 1972, and we thank you for giving us the opportunity to gain your trust. And don't forget that Pueblo Tires also offers financial options.
Claro que sí, tenemos financiamiento. Recuerden, amigos, tenemos 24 meses para pagar. Y ¿sabe qué? Usted vaya y aplique. No necesita crédito. Y además, si usted paga en 100 días, se ahorra los intereses.
Así es. Bueno, amigos, con esto nos despedimos. Don't forget this. Nobody but nobody loves you more than Pueblo Tires and Service and Nova Medical.
¡Nobody!
Así es, amigos, hasta 24 meses para pagar. Y no necesitas crédito. Si ellos dicen no, nosotros decimos sí. Llevo eso al banco, puedes apostar.
No hay tal cosa, Shampoozy, te apuesto.
Sí, tienes la opción de hasta 100 días para pagar temprano. No esperas el income tax. Ven hoy mismo. Aplica, compra y disfruta. Así es, shampoozy.com. ¡Que bailen!